There we go.
Okay, so yes, I have 5 kids, and for the most part, I just power through it. But there's so my son's birthday was on Monday, and the pain was so bad, I just went to bed at 8 o'clock, and they had the birthday party without me. It's not great. I kind of hate it.
Yeah. So it sounds like one of your goals is being able to stay up without pain and maybe hang out with one of your children on their birthday.
Yeah.
Kind of, we can identify that. So really family life, home life is affected by this, and we'd like to improve that, is what I'm hearing.
Yeah. Yeah. I mean, that's the most important thing. I can power through work and make it work, but when I feel like I'm shortchanging my kids, it sucks. I have a very patient wife.
Well, that's fantastic. It's always good to have a good partner. So here it would be, I'd go, okay, so what I'm hearing is you have some sensation of glass and weakness in your knees, some pain. It sounds like that goes along with that. That is, I think you said a 7, and that is pretty constant. And typically you take ibuprofen to help you with that. And it keeps you really from doing some activities with your family that you would otherwise like to participate in. And you want to improve that. That maybe is what your motivation is for coming in today. Did I hear you correctly?
That's right.
Okay. So here I'm going to do some orthopedic exams. So where you guys would do spinal exam, I'm going to do peripheral exams. Or for instance, if you told me lower back, I would be looking for radiculopathy, right? So I'm not going to do a spinal segmental. I'm going to do straight leg raise, Patrick and Faber's, and all these things. Or if it's neck pain, I'm going to do compression. I'm going to do maximal compression and just look for symptoms of radiculopathy, right? And then in your periphery, whatever your joint is, I'm just going to go through a series of tests, and I'm going to tell the patient. So these tests are geared to sort of recreate your pain. So my intention isn't to hurt you, but unfortunately, these tests, in order to be informative, may cause you some discomfort. Please let me know if that's the case. Like I said, my goal isn't to damage you, but rather to really figure out what's going on so we can get a specific diagnosis and proceed with treatment. Does that sound okay to you?
Oh, yeah. Yeah, that works.
So, then I would go into, let's just say, a basic knee exam. We'd go through varus valgus, anterior, posterior drawer, probably check out the hip and do a little grind, see if, check for FAI, and then we go down to the ankles, make sure everything's stable, ligaments feeling good. And then I would say, I definitely felt some crepitus, and it looked like you had some joint line pain. Also, let's say it's arthritic and not a meniscus, and so that's good, because sometimes meniscus can flip up into the joint, right? So we can't treat that. That's surgical.
Yeah.
So but it looks like you have grade 3 osteoarthritis in your knee, based on my physical exam findings, and I've already reviewed your x-rays that the chiropractor took. What I'd like to do is figure out, so before you had COVID and prior to your car accident, do you feel like your knee was entirely healthy?
Oh, yeah. Yeah. No, I used to, I ran marathons and went hiking and bicycled 100 miles a week. And
wow.
Yeah, I used to be super, super duper active. And then since the car accident, and then since getting COVID, I mean, so the last 2 months, I had to just decide that I was going to do stuff regardless. So I've bicycled about 900 miles in the last 2 months. It's terribly painful,
Wow.
but my pants fit again. So it's had to buy new clothes. But yeah, no, it went down so like jogging. I used to jog about 10 miles a day, and now I don't jog anymore at all. I can't. It just, the strain and the pain is just, it takes it straight to a 10.
Wow.
But I don't do it anymore.
Yeah. So it sounds like you're getting back into cycling. It's painful. Maybe you'd like to get back into jogging if you can.
Oh, I love
But
it.
exercise is important, right? I mean, wouldn't we? I was there as well. I had a knee surgery which stopped me from running, and I'm still mentally trying to get back into that space. Um, okay, so sounds like we really want to get that knee better so that you can continue doing the things you want to do in life, including being a good parent, exercising with less pain. So it's not something you dread doing, I assume,
Mhm.
just to be able to keep our wardrobe right. Um, so here, I'm going to tell you what I think is going on. I think you may have a little bit of, with COVID, it's just so difficult to see what structures would be affected. But I'm going to say, like I said, based on your X-ray and the joint space indicated there, I think you have grade 3 osteoarthritis, and the orthopedic findings suggest that perhaps you're a ligament in your knee called your medial collateral ligament is potentially just a little bit lax, which that means is there could be some inflammation in there. There could be some damage to it. We won't know that until we take a look with the ultrasound. And so I'd really love to do an ultrasound of your knee today to see if we can get confirm the diagnosis and get a look at any of the surrounding structures. Now, this won't let me into your joint space like the X-ray did, but it'll let me take a look at like your patella and the ligaments that are surrounding the muscles and the tendons that are there to see if there's anything going on that we may need to treat. Does that sound reasonable to you?
Oh, yeah. Yeah.
Okay.
I love that.
So now we want to talk about the reason or the different phases of healing. Right? There are 3 different phases, and I'm sure you've heard some or all of this from the chiropractor. But I'm just going to summarize this for you pretty briefly. And if you have questions, I'm happy to answer any of them. The 3 phases are the inflammatory phase, which is just what it sounds like, the repair phase, which is when we start to put scar tissue down, and then we have the remodel phase, which is when we start to gain strength and flexibility back. So at best, with the remodel phase, you're going to get about 80% of the strength back of the original tissue. That's at best. If we leave this alone, you could get 30, 40% back. And the longer we wait, the harder it is to get some of that functionality back. But just to recap, the inflammatory phase is essentially when cells, pardon me, allergies, asthma. So the inflammatory phase happens when damage happens to cells. Those cells burst open and send signals to your body, mainly through your bloodstream, to recruit healing factors to the area. And some things that get damaged don't have great blood flow. So we want, so nonetheless, those factors have been released. This instigates an inflammatory response, which is painful. And that's why you're experiencing pain and why you've been told to ice, because this helps deal with some of that inflammation. But those chemicals are absolutely necessary to begin the healing process. And that lasts for about 3 days. After 3 days, I'm not saying that's not going on anymore, but now you're beginning to repair yourself and you're putting in scar tissue. So you have something called type 1.
Collagen.
Oh my God. Yeah, collagen. Thank you. I'm all about cartilage right now. So I don't have a whiteboard. Type 1 collagen looks like this. So it's very straight. It's strong. It's got if you don't know what tensile strength is, you can pull it. You can kind of do all sorts of things to it. And it's great. It's strong. It's going to be very resilient to these things. And that has to do with running, bicycling, all of that. Now, when it's damaged, it never looks this pretty. Not that my handwriting is pretty, but you can see where some of that tissue has been torn. That's where those cells have been damaged, and they've then brought those chemical signals to the area, right? And so that same spot, as the inflammation or the inflammatory cycle goes down, we begin to remodel, and we get this jumbled up mess of scar tissue that is type 3 collagen. And it's weaker and not as strong as type 1 collagen, but it's what your body has to do. So you get about 10% strength, throughout this repair phase from the type 3 collagen that's all kind of bundled up and it's a mess and it's not the straight lines. And you also have more nerve endings in there. So the problem with that is you're already having pain, right? More nerve endings means more potential for your brain to receive signals of pain. Not only that, normal nerves have a particular threshold at which they fire at to send you a signal. What happens with these guys is they're what we call hypersensitive, which means their threshold is lower than a normal nerve would be. So not only do you have more of them, they're more sensitive and more likely to send pain signals to your brain. So obviously we need to do things to reduce that. And we want to straighten out those fibers through a variety of treatments. One of those is the chiropractic adjustments you've already started on. Some of that can be chemical in the sense of we're sending your platelets from your blood to the area that doesn't really receive a lot of that because there's poor blood flow in a ligament or a joint space. It's like your knee. So we're gonna talk about that a little bit more. We're gonna get into the remodel phase. That's where you're really regaining strength and where you really want those fibers to be forming as straight as possible. And even though you're going to have more nerve cells or nerves going through the area, you want it to be as ideal for those nerves as possible, not getting pinched or bound up in the new tissue that's being created, which is why we're going through this treatment. And PRP is going to help you do that by continuing to give growth factors to the area. Does that all make sense to you?
Yeah, that makes sense.
Okay, and if you have any questions, please interrupt me at any point in time. I can be long-winded, and I want to just make sure you're getting the gist of what we're talking about here.
Okay.
Yeah. So now I would ask for permission to go ahead and do the ultrasound exam, maybe have you change or whatever we have going on in the office I'm at. So boom, turns out, looks like, your MCL is a little bit, you have a little bit of inflammation in it. Looks like it was damaged just a little bit when you, I don't know, were hit by the car 15 years ago. And so there's just a little bit of inflammation inside of that joint. So you can, and I usually show too, like you can see on the screen here, here's healthy tissue, here's not healthy tissue. And we can see how it's not healthy. I'll explain a little bit why there's fluid in this space. So just like I thought, this is what's going on with your ligament. The X-ray confirmed your diagnosis of stage 3 osteoarthritis. I don't know what to do with COVID arthritis or viral induced arthritis.
Right, my doctor doesn't either.
Well, I mean, it's so new for all of us, right?
Pills, like good luck.
I really do want to try PRP with you just to see if it helps.
The one thing that has made the biggest difference is when I got the vaccine, it stopped for about 3 months. And then slowly came back in. And then when I got the last booster 6 months ago, it like just turned off for another 3 months. Wow. That makes literally no sense. Like it doesn't make any sense. And I've read 4 or 5 studies now. They don't know why it does that. But for a lot of people with long haul arthritis, they're like, it works. We don't know why, but it works. So, so I don't know. That's the only thing so far that's made any difference.
Yeah,
and it shouldn't, but it's okay.
Yeah, I mean, and this the thing is like it just because it shouldn't doesn't mean it. Like there's something is going on.
So I'm coming up for I'm eligible next month for my next booster shot, and I'm like, all right, it's happening. Turn this off for 3 minutes.
Like I said, I mean, this is purely experimental on my end, and I think there's some good reasoning to say that I don't think that any harm would come. Have you had PRP before?
No, I've watched it. I've watched several patients go through it, but I just haven't done it.
So because if you had an adverse reaction, right, then we probably wouldn't want to do it. If we don't know, then most people don't. And what I tell everyone is about 75% of people are going to respond, right, to PRP. 25% of people don't respond. We don't really know why. There's not an age. There's not a type of injury or a condition that we can say, okay, other than advanced stage arthritis, right? Like if you have a fused joint, you need surgery and you need a new joint.
Yeah.
And I hate to say that, but it just is. Even stem cells, none of that's really going to change that. But grade 3 and below, symptomatic, a lot of good benefit from most of the time. So that being said, there are a few people inside of that experience an increase in pain, like an increase in an inflammatory response. And that's something that can be dealt with if it occurs, but is very, very, very unlikely to happen. We use good technique. We use a verified process for how to deliver the PRP and spin the PRP to do it. And we get it in there. And worst case, most of the time, is nothing happens. Best case is you report that this helped me out for the last 3 years, you know? So it's just a thought, but.
All right. So, and then when you've wrapped up your stuff, you take them up to the front desk, and then
right,
you're scheduling them for the next appointment.
Right. And for me, that's going to be in a week or two.
Okay.
Depending, it won't be. So I'll say, so I think you're a good candidate. You're going to really respond well to PRP therapy. You know, like as we just talked about that 75-25% as part of their Part Q. If you want to do it, I highly recommend at least 3 injections, preferably 4. I suggest doing that 1 week, you know, so first injection tomorrow or a week from now. You know what I mean? I will figure out more what they want me to do with that regard, because the first one doesn't matter so much.
Mm-hmm. Yeah.
In a week, I want to see you again for your second injection. In the second time, I want to see you for your third injection a week later. And then I think I want to wait 2 weeks out to do your final injection, 4 weeks. After your first injection, we're going to know for sure if you're responding. If it seems like you're not responding, we'll come up with a different plan at that time. And I may switch to Prolo at that point.
Okay. Perfect. All right. Yeah, I mean, it's a good day one. Thorough. There's points where you'll want to tighten it up a little bit, and I know you know that. So the discussion about phases of healing, you want to tighten that up, make it a little more concise, still keep the same types of details that you put in there that made it feel very clear, but then just tighten up the language. And then the digging for need. So we talked about this a little bit with Tony, but making sure that you're getting even though they've gone and seen the chiropractor, it's that differentiating between the hook and the need. That's the part where every chiropractor who comes in here and nurse practitioner, naturopath, and everybody else. And for the most part, sometimes they feel like the same, because you're like, oh, well, I need the anchor. Maybe the anchor is the need. The anchor cannot be the need, right? So the anchor is the mechanism of injury. The need is the impact on their ADL.
Right. So being a good father and the
right. Yeah. So you did a really, really good job about that. The tendency is to rush through that second part, right? So you'll find a good anchor, you'll get really excited, and then you'll kind of be like, hey, you just want to be able to go to work and not be stupid. Like, that's great. And it really does take a lot of work to fight against the tendency to assign somebody a need that you think you know, right? And
Right.
in this case, you did a very good job of saying, hey, once you've found like a hook, a little bit of something, you're like, okay, well, you're not really worried about work. What are you worried about? You know, let's talk about family. And then you're able to dig deeper into that to be able to get to the heart of what's going on. Yeah. Which is excellent, because that's the humanizing effect on what you're doing. So this is, it wasn't really role play at that point. I feel like you actually care about what's going on with me.
Right.
Right. It's not just like he's just doctoring and he's trying to just do he's going to do. It's like, okay, you're actually interested in what I'm saying. You're listening to me. You're repeating back, and you're digging deeper into the concerns that I have. Like that's an actual concern that I have.
Right.
And I would not have shared that with you if you didn't ask. So
For
it was
sure.
so it was very good. Like that's the heart of what you're trying to do, because at this point you're establishing. I mean, you've got 10 minutes to build this relationship of trust with me, and you've got a limited amount of questions and things to do it in. So that part was excellent. That was really well done.
Thank you. I appreciate that. And I can definitely, what I'm hearing is I need to tighten up the phases
Mm-hmm.
a little bit, but keep the detail, keep the gist, just
Mm-hmm.
pare it down a bit,
Yep.
and dig a little bit more into the need so we can really
Yes.
explore that. And it feels like that could also be an objective measure for the
Yeah.
patient as well. Like, okay, so you want to be a better parent, you want to be able to stay up a little bit more. How was it the next time I see you? How was it with your children? Were you able to play with them more at night?
Yep.
Um, did you feel like your mood was a bit improved, if the pain was improved, or whatever
Yeah.
we identified within your need?
Yes. And you absolutely want them to do that each time, because it's building a commitment to what you're doing, especially when sometimes the results, you did all this testing on me today and it hurt. And I go home and I'm in a little bit more pain than I was the day before. And then I'm coming back for the next visit. You told me that was going to happen. And you're checking and saying, hey, I'm sorry if this, if it made it rough for you yesterday. That wasn't the intent. I did let you know because I just want to make sure that you know what to expect. So we're ready to start moving forward with treatments.
Right. Yeah, I did forget to say, hey, by the way, you may be a little bit sore tomorrow. Some of these tests, like I said, are going to stress some tissue. So just so you're aware, that's totally normal. Nothing is worse than it was when you came in. Yeah, I do apologize for that, but this is necessary to get a good diagnosis for you.
Yeah. No, it's very good.
Yeah. All right. I appreciate that. Thank you. Oh my gosh, Neil. Got it.
All right.
I am so terrible with names.
I'm not.
I try to. Yeah, all I see is Colton. I know I have Chris there. But yeah, so I guess we're doing this again next week, doing day 2 stuff.
Yes, correct.
So
I would, if I were you, I would practice this 4, 5, 10 times a day until next week. That's really because once you get in front of somebody, and when you role play, ask that they just be themselves. Like I kind of hate role play sometimes because you come up with funny things. You're like, let me make it hard. So ask them, hey, look, I'm going to ask you these questions. If you're actually going to come see me, can you just answer them? And try and, I'm going to practice this because I need to practice this dialogue. So I make sure that I'm addressing all these issues and making sure that I'm hitting these benchmarks in our conversations. But just be you as we talk about this, so that you're getting a more realistic experience with it. Because once you're sitting in the office, then it's for reals. You're doing it, and it just is it can be uncomfortable. But
yeah, I do have a great excuse for keeping I can keep the paper up, because this is a disclaimer I do with every single patient I've ever worked with. So I'm a bit of a Stone Age guy when it comes to technology. And when I type, I want you to know that I'm trying to get your full story down while I'm listening to you, even if I'm not looking you in the eyes. And so I just want to be very clear. If at any point you have a question for me or anything, I will stop and we can look and talk face to face. But in order for me to get this down clearly, I have to look at the keyboard because I'm old and I'm not that great with technology.
24.
Oh, I'm 45, man.
45. Welcome to
yeah. So then I always just keep my prompts up on the screen because they can't really see that. All they see is me typing. I have a prompt, and I can very good at keeping the ear out and responding, but now they know I'm connected to them. but I need to get this into this computer because every doctor types in their chart while they're in the room, right?
Yeah. Well, perfect. All right.